Great. Let me save more in the waiting room. Okay, so thank you so much for joining us today, everyone. My name is Rachel Paul, and for those who don't know, I'm the Women's Sector Lobbyist with the Women's Resource and Development Agency, and I chair and coordinate the Women's Policy Group for Northern Ireland. WRDA is also the co-conveners of the Childcare for All campaign with Employers for Childcare. So we're delighted that you're able to join us today for this webinar. It's a part of a series of webinars that we've been doing following the launch of the Feminist Recovery Plan last year. And today's event is going to look specifically at childcare, COVID and women 1 year on to see the experiences of women working in childcare, the key recommendations we've been making on to try and advance the situation in childcare, and also some of the experiences directly from women themselves. So it's a part of the International Women's Day campaign this year. And to us, we really see childcare and care more generally as being the main change that needs to happen in Northern Ireland to advance gender equality. So I've already got the recording on, and it's going to go up onto the WRDA website after today's webinar. And you can also look at the past webinars that we did as well. So I'm just going to ask that everyone keeps themselves on mute unless they are speaking as well. So the International Women's Day theme for 2021 is Choose to Challenge. That's the global theme. And well, in Northern Ireland, we decided that women have been challenged enough. So we decided to go with the theme, The New Phenomenal, where we celebrate phenomenal women who have kept our society going over the last year, which has been so challenging, particularly those working in childcare. So we also said that we don't want to go back to the old normal, or when we're talking about having a new normal, we really think that now is an opportunity to create change in our society to make it more equal, so that we are calling for a new phenomenon that celebrates women who have been upholding our society. So in light of that, we have a brilliant lineup of speakers today. So I'm going to give a quick overview at the beginning of the Feminist Recovery Plan and our recommendations relating to childcare. Then we're going to have Alexandra Chapman from Employers for Childcare, and she's going to cover a bit on the most recent Northern Ireland Childcare Survey findings. Then we're going to hear from Julie Kinnear, the Deputy Manager of Childcare at Windsor Women's Centre, and she's going to tell us a bit about how they coped with staying open during the pandemic, adjusting to the different regulations every week, and generally how they were able to run things. And then last but no means least, we're going to hear from Susie Douglas. And Susie is a registered childminder and member of the Unite the Union Registered Childminders branch. I'm just going to make sure everyone's on mute. 1 wee second. So that'll be our lineup. And at the end, we're going to have a quick 10-minute general discussion. And we have some questions that were submitted in advance, so we're going to discuss them as well. So I'm going to pull up a PowerPoint really quickly just for going through my section here. Let me just make sure I've got everyone from the waiting room in first. Now, can you all see that okay? Yeah, I can see a few nods. Okay, so this is going to be quick, just a few minutes for you, but basically I'm going to give this overview of the Feminist Recovery Plan and our recommendations on childcare. So back in July 2020, the Women's Policy Group published the Feminist Recovery Plan, which highlights the truly disproportionate impact that the pandemic was having on women and the really urgent need for a gendered response to be taken to what was clearly a gendered crisis. This plan includes 6 different pillars covering a whole range of evidence and recommendations. And today I'm going to just focus on childcare, which is under our economic pillar. If I have more time, I would go into all of them in more detail, but I'll send it through to all of you in the chat so you can see it fully. But basically, within our childcare recommendations, we're calling for it to be treated as a part of our key economic infrastructure. We argue that it's an issue for gender equality, for women's full and equal participation, both in being able to access childcare, but also for the childcare workforce, which is majority women. We also are supporters of the Childcare for All campaign, and we're calling for childcare to be seen as a public good instead of a private matter for the home where it falls to women. So this is just a quick bit on care responsibilities more generally and how they disproportionately fall to women. So women dominate low-paid, insecure, and precarious work. Women also are more likely to give up work as a result of care responsibilities. 91% of lone parents in Northern Ireland are women, and they're the ones that are most impacted by occupational segregation, where they work in sectors where it's predominantly low paid. And women also make up 69% of all carers in Northern Ireland. So this graph here, I just wanted to include it at the beginning because it shows the difference between men and women and how many extra hours they spend per week on unpaid care. And you can see here that women overwhelmingly spend more time on unpaid domestic work in the home and care responsibilities. The only exception is transport, which is quite ironic because this includes men's transport to work. So it's not really a true reflection of the unpaid care that women do in this area. But crucially, sorry, just go back. Carers NI have done some research and it shows that unpaid carers save 4.6 billion to the Northern Ireland economy every year. So this is a part of our society that is upholding the very nature of our society, but is completely undervalued and underfunded. We also know that 26% of all workers have unpaid care responsibilities and are trying to juggle work and unpaid care. So really, we want to make the argument that childcare is a key part of our economic infrastructure and is completely necessary for women to be able to work. In the context of the pandemic, we argue that it's not possible to transition to any stage where we have no lockdown without the issue of childcare being treated as a key priority by the executive. Despite this, childcare was completely absent from the Northern Ireland Executive's roadmap to recovery last year. And now, 1 year on, we've seen them launch another pathway to recovery and also an economic recovery plan. And childcare has again been totally left out. So they know that childcare is essential. We've given them this evidence over and over again, but it's still not being included in the key decision making that's happening. The lack of accessible and affordable childcare, which is fundamental to facilitating women's full participation, is just non-existent at the minute in Northern Ireland. And without it, their access to paid work, education and training is completely restricted. And this isn't an issue that just impacts a small number of people. 40% of families in Northern Ireland, which is around 350,000 workers, have dependent children. About 47% of these rely on family support and other family members for childcare, which again was extremely difficult during the pandemic as mixing with families was not allowed unless you were in a bubble. And just for contrast, in Scotland, 75% of childcare is council run and funded by the government. So we covered a bit as well on accessibility and affordability and around the rising costs of childcare and increased economic hardship. Childcare is the biggest monthly bill faced by 35% of families in Northern Ireland, where it costs more than their mortgages or rent. And the World Economic Forum found that UK parents pay the highest childcare costs in Europe and the second highest in the world. Alexandra will definitely go into more detail on childcare costs in the survey for this year, but the 2019 survey found that the average cost of a full-time childcare place was £166 per week, or £8,632 per year, which was an 11% increase since 2010. So worryingly, 51% of parents with under 11s said that they would struggle to make ends meet within the next 3 months in a recent survey, and that rises to 56% for single parents, which again, the majority of those are women. So this again is also from an older Employers for Childcare Northern Ireland Childcare Survey. So I'm not going to dwell too long on this, but really just wanted to show how for lone parents, they have to go to more risky forms of lending and borrowing to be able to pay for their childcare. So this clearly is a gendered issue as well. So I think it's already clear why it's a gender equality issue, particularly for the increased likelihood of poverty that women face and the exacerbation of pre-existing inequalities. But without this provision, we really see that there's such a cost to our society, both in women not being able to access full-time work, also in women working in the childcare sector being underpaid and below the real living wage. We also know that since the COVID crisis began, that women are now a third more likely to be furloughed than men, and much more likely to have lost their jobs. So childcare workers in general, we know we're going to hear a lot more about this from Susie and Julie, but just some of the women's policy group concerns around how childcare workers are treated. So we believe that the childcare sector in general is undervalued and underfunded, and this urgently needs to change. The underinvestment and gender segregation in the sector shows that care work is underpaid and undervalued, despite how critical it is to the functioning of our economy. If childcare is to become a valued service, then the workers who provide this service also need to be valued. Significant action needs to be taken in order to bring workers into the childcare sector to maintain staff morale and reduce turnover, return workers for their skills and their experience, because almost a half of all childcare workers earn below the real living wage. This is so much higher than the proportion of all workers who earn below the living wage. And the median annual salary for childcare workers is almost half of what it is compared to the average of all workers. So basically, some of the arguments we have for investing on it is that research shows that a 2% GDP investment into childcare creates twice as many jobs for women and almost the same amount for men, compared to a 2% investment in construction. We believe that it will lead to the increased participation of women in the workforce, can generate a full return on investment according to data from the Women's Budget Group, and it should also be considered a part of sustainability investment and any Green New Deal that we have. So our key recommendations are around investment, incorporating it into the Climate Change Act as well as a low carbon emission sector, urgently developing a Northern Ireland childcare strategy and provision, particularly in line with CEDAW recommendations, which highlighted the concerns around the lack of a government funded provision here. We also want to raise awareness of the need to improve childcare job quality, create family-friendly policies, particularly for families with disabled children and ethnic minority children, and to increase diversity in the sector. So I'm going to send this round everyone, but you can see our full recommendations in the Feminist Recovery Plan, and I'll send some information as well on the Childcare for All campaign. But that's me. I'm going to hand it over then to our next speaker, who is Alexandra Chapman from Employers for Childcare and co-conveners of the Childcare for All campaign.
Morning, everyone. I'm just going to share this with you now and let me know if it's okay. Can everyone see that okay? Yeah, just get a nod from, I can see Rachel. So yes, my name is Alexandra Chapman and I'm the Research Policy and Information Officer at Employers for Childcare. So I'll be presenting on the findings from our Northern Ireland Childcare Survey. And it's great to be here. So thanks for organising this, Rachel, and great to celebrate it as part of International Women's Day and celebrate all the phenomenal women in our amazing childcare sector. So just a wee bit about Employers for Childcare. We are an award-winning social enterprise and registered charity. So our charity work includes a free phone helpline service, which last year provided over 5,000 benefit calculations. And we also carry out research and policy work. And last year, in August 2020, we helped set up the all-party group on early education and childcare. So yeah, great to be part of that. So about the research, which I'll be focusing on this presentation, we have been carrying out the Northern Ireland Childcare Survey since 2010 to explore the experiences of parents and childcare providers in Northern Ireland, and our findings are used to inform political discussions and debate, and also to inform policy development. So the research that I'll be presenting on today was carried out in 2 stages in 2020. So the first stage was before the pandemic. So that was data was collected between February and March 2020. And then just as we got the survey results in March, the pandemic struck. So we decided to do a follow-up survey with parents in September and October. So that focused on the Covid-19 pandemic and parents' ability to access work and childcare, and that focused on the first lockdown. So overall, we received a really high response rate, and we received over 5,000 responses, which was just brilliant. And we collected the data through online, circulating the survey widely online, using social media and our own networks, and participation was voluntary, and all responses were anonymised. And then the data was analysed using Microsoft Excel. So as Rachel said, it is important to frame this presentation in the context of childcare affordability and accessibility. So the average childcare place for a full-time week in Northern Ireland last year was £169 per week. And from our research, we know that 1/3 of parents reported childcare as their largest monthly outgoing, which exceeds their mortgage or rent payments. And many families also reported using means other than their income to pay their childcare bills. So that includes savings, overdraft, and also payday loans. And then at the same time, we know that childcare providers also face many financial challenges. And last year, over 1/3 of providers reported a decrease in their income in the previous year, with 72% having either broken even or made a loss. If we look at this, again, this means that providers have shown that their economic situation, we asked them how they thought their economic situation of their setting would either improve, stay the same, or worsen over the next 12 months. And the findings paint a really worrying picture, with 42% anticipating that their economic situation would get worse and just 15% thinking that it would improve. So I think that these findings really highlight just how much the current childcare system doesn't work for either families or childcare providers. And it's also important to highlight that these findings were from before the pandemic. So we know that the pandemic has only exacerbated issues within the childcare sector, and it's just important to recognise that these are before the pandemic. So moving on to the impact of work and career progression for women, we know that access to affordable childcare is essential for parents to take up or remain in work, training, or education. However, where the cost of childcare equates to a significant proportion of their household income, some parents may question whether they need to change their working patterns to either access or afford childcare. And as you can see in the graph, our research shows that mothers are more likely to experience a change in their working hours or their working patterns compared to fathers. And then looking closely, where there was a change, we asked respondents to identify a reason for this. And as you can see from the graph, the cost of childcare was linked. Almost half of mothers said that was the main reason why they changed their working patterns. And again, you can see the contrast between mothers and fathers and the impact that this has on specifically mothers. So the three key things that emerged from this research: the first is that women feel that their career opportunities are being sacrificed. And this is often linked to traditional gender roles and pay disparities. The second is linked to childcare affordability, with many parents telling us that they feel that they're working at a financial loss and question whether it makes financial sense for them to remain in the workforce. But we also hear a lot from parents who say that they want to remain in the workforce because they want to provide a good example for their children, and that they also want to build on their career, even if that means that they are working at a loss, financial loss. And a lot of parents also tell us how happy they are to do this or content to do this because they want their children to be in a childcare setting and to help, support their development and their educational opportunities that they can get from that. So I think that that's important to recognise too. And the final thing which emerged is that some parents face barriers to accessing the workplace. So where they're unable to afford childcare, it means that they aren't able to get into work or stay in work. And one example which we've seen time and time again, and something that we continue to lobby on, is the upfront childcare payment under universal credit, which prevents parents, mostly women, from starting a job or getting into work. And it's simply because they can't afford that upfront cost, which is a massive barrier to parents. So if we look specifically at COVID-19, this is the bit that's followed up from our follow-up survey, which we wanted to explore with parents. And this was really, we focused on April to September. So that was whenever there was no school. Schools and childcare were only open for children of key workers. And the findings show, we know that this had a massive impact on all parents, and it was really a tough and challenging time, but the findings show that it had a significant impact on women. And over half of women said that they were balancing work alongside their childcare responsibilities, and 20% of mothers had to use unpaid leave or annual leave to manage their childcare, and 31% were working outside of their normal working hours. And the two quotes at the bottom just reflect how much of an impact this had on parents and families trying to balance this, which was a massive strain on so many parents. And again, we heard a lot of anecdotal evidence from parents who highlighted the mental, emotional, and physical toll that this took on them, and also their family. But we also heard some really good, some moving stories. So this case study, for example, of Sarah's story, who was a key worker during the pandemic and just emphasised how much her childminder was a lifesaver to her and how much she owed her, and she would be unable to access work if her childminder didn't continue to provide the service that she needed. And just the last slide, Rachel, because I know you're going to move me on soon, is that finally going forward in the context of COVID recovery, we need to use this evidence and this research that's within the Feminist Recovery Plan to ensure that the contribution of women through unpaid work and it is made to our society. It's recognised, this needs to be valued, and that the barriers that exist need to be removed. It's vital that women are also included in decision making within all departments and within consultation processes. And finally, in bold, we need a childcare strategy urgently in Northern Ireland. We do not have any more time to wait. We can't afford to wait any longer, and childcare needs to be a key priority moving forward out of this pandemic. And that's me. Let me just stop sharing this now. How do I do that, Rachel? Do you mind? Stop sharing. There. Thanks.
I'm sitting talking away on mute. Thank you so much for that, Alexandra. And I think that really just paints a stark picture of how challenging it has been for families and childcare providers, and really just why we urgently need a childcare strategy. So we're going to go next to Julie Kinnear, the Deputy Childcare Manager at Windsor Women's Centre. And Julie's going to tell us a bit about her experiences of managing childcare during COVID from a women's centre perspective, who have absolutely been crucial throughout all of this as well. So I'm going to go over to you now, Julie.
Thank you. Yes, I'm just going to talk a bit about how we coped at the start of lockdown to keep our services going to help as many families as possible. So again, when it sort of started, nobody was quite sure of the guidelines, what was happening, how we were going to carry it out. And again, guidelines were slow at coming through. And when they did come through, it was still, there was never a yes or no answer. They were still quite open to what you took out of them as well. So to start off with, then we linked in with a thought, can we do this? Because it's paramount to keep the safety of the staff and the children at all time. So we did discuss with the staff who was willing also to come in, because as you know, we're a women's centre, all our workers are women. So again, there was the childcare issues that comes back to the start. Are those families going to be able to come in? Were we going to be able to keep the centre open for them to allow our services to go ahead? Because a lot of their childcare is elderly parents as well and grandparents, which that was no longer a case for them to be able to look after. And then some of the children do come to our services. So it was about managing what staff were able to come in to manage the childcare, how we could help and support them the best way with that as well. So again, what we did, there was only 2 staff members out of our whole staff team that chose not to come back to work. And again, that was due to their own illness and their fears and worries of coming in, because nobody knew how the pandemic was, how fierce COVID was. It was the unknown, and a lot of women were very scared. So then the second challenge that we came across, that we said that we would work the best way as a women's centre to support as much childcare and to rotate our services to help them, support them, but also to allow them still to come into work. Then the next thing was the guilt of the parents, of the women, was, am I putting my child at risk coming in to the centre to provide for other families and then bringing this virus home to my family and my children? So there was a lot, that was our biggest barrier for the women, was a lot of guilt. Were they being selfish to support other families, but putting their own families at risk? So what we did was we found out as much guidelines, as much resources as possible. So all our staff went on training. So training became for COVID awareness, and then they went on for infection prevention control training. So again, that gives the women a bit more knowledge of how we can manage it, what the risks are, and what we can do to keep ourselves safe. So after to and fro discussions with the women, that they did decide that no, we want to help here, we want to support other families to keep things going. So then what we did was we decided to reduce services. To reduce services to keep the footfall through the centre coming in and going as to the minimal as possible. Because again, staff and women were just scared of this being taken home to their families. So what we did, we put in risk assessments. So we contacted social service to see what we were allowed to put on, how many children and what our regulations was. So again, all risk assessments right down to from somebody using the toilet to somebody washing their hands to preparing food. There was just risk assessments, risk assessments, risk assessments. So a lot of paperwork went on. But again, that was to ensure the staff, to keep them safe as well, that they knew that we were taking every measure possible to keep them and their families safe. So what we decided to do was have two teams. So we had a purple team and a yellow team. So that allowed, if one team did become infected and had to close the bubble down, that we had the other team then to step in and take over. So it was week on and week off, which helped some families. So it meant that they only had childcare issues for 1 week on and 1 week off. What we decided to do then was we got one of our separate buildings registered. So we opened our TAPE building, which usually is for counselling and mental health and wellbeing. We opened that for the after schools / the parents of the women that was coming into work. So that was the two groups as well. So there was one group for daycare and one group then to cater for the older children and the staff of the children. So again, that was another guilt part of the women. Am I selfish of bringing my child on the premises? Am I selfish of bringing them in? So it was a lot of guilt on the parents. Were they doing it right? Was it right or wrong what they were doing? But again, with a good team of ourselves, we discussed everything and they were happy enough. So again, all the measures was put in. We followed all the guidelines, put loads of risk assessments in, fully trained the children or the staff to give them as much knowledge as possible. So that's what happened, week on and week off. And then, so we reduced the services, one-way systems in and out of the building. Again, buzzers, nobody was allowed in unless they had an appointment. And then we had to manage how we were going to settle the children in. So our usual procedures would be the parent would get to come in, look around the building, see how we manage, and then it would be an hour settling, then we build that up. That was no longer the case, as we were taking a lot of families from some from the hospitals, key workers, parents that never met us before and children that never met us before. So what we had to do was nothing was allowed to come in and out of the daycare, only the child and their coat on them, and that was it. Nappies got left at this weekly. So nappies were provided and wipes, and they stayed on the premises to reduce the risk of from the daycare to the home. So again, parents were having to hand children over to us who had never met us before. Children, I have to say, so resilient, so brilliant. They adapt really well to this, and we really had fears because we're all mothers ourselves. You imagine handing your child over to a stranger. We had fears for those parents themselves dropping off, but it went a lot better than what we thought. So the children adapted really well to it. So again, children come in small groups. Ages were allowed to be mixed in the bubbles to allow for families and siblings, because rather than having two separate siblings in two different pods or bubbles, it would reduce the risk of contamination if there was any COVID cases coming in. Then also, before the children come in, we had to make sure there was daily risk assessments. So before even staff started off the day, they had to make sure everything was clean, sanitized, washed. That all had to be ticked and evidenced off to prove that we were doing the best of our ability to keep everything safe. So a lot of risk assessments ticking off. Then on a daily basis, all children hand washing, staff hand washing coming in. Then again, we had to then start showing the children what PPE was. So we had to introduce PPE into the children, so they weren't scared of when we were coming with our masks and our gloves and our aprons. So we created circle times, song times, we made songs up, we made rhymes up. We done as much as possible for circle time and told them when we would be wearing that. We put some down on the carpet areas for the children to explore and touch to see what it would be like. And again, the children, resilient as ever, adapted really well to this. So again, PP had to be put on quite a lot of the day, for especially napping, changing, handling of food, all stuff like that. And then all toys. Each time we finished playing with a toy had to be sanitized. So again, it had to be washed and put away. If we didn't have the time to wash, it had to be put away in an area for 72 hours. That all sounds simple, but you start running out of areas of where to put the toys. You start running out of staff that can go and wash toys while they manage routines and snacks and activities for the children. Because again, we had to keep it as fun and as possible for the children, because they were coming in. It was like a normal day to them, and well, not so normal, but we had to make it as normal to them, and that they didn't feel scared, that they wanted to come to us, that it wasn't fear. So as well, it was just constant thinking of ideas, and it was just staff still worrying about their own families, and bringing their children into the setting. So again, we did come up with scenarios the quickest way, and by the end of it, staff hands were red raw, were washing. We were near enough running out of toys. We had to reduce all soft furnishings from the daycare as well, because that was too much of a risk of contamination, because there was no way to sanitize them or clean them. So our lovely coloured room became a very cold, sparse room as well, which was very hard to look at. We're reducing the services. The building became very eerie and cold. There just wasn't that usual traffic of the parents coming through. Then we had to for staffing, we had to address staffing's breaks and lunches. It was no longer possible for us all to sit as a group and have our lunch, because again, you were mixing of bubbles, so it was cross-contamination. So again, we had to then create more staffing areas for tea areas and lunch areas. And again, that more or less impacted on staff having their lunch on their own. Now, the first few weeks, it was sort of okay, but as the weeks went on, we realised it was impacting on staff's mental health. Staff were becoming very low and down, sitting on their own, having their cups of tea and their lunch. Nobody to speak to. That usual, I don't know if you all work in groups, but as a group and a community, we get quite a lot of enjoyment over our lunches. So when you're in daycare, and as much as we love it, it can be stressful at times. Our offloading ourselves for our own well-being is our lunches and talking with the other staff member. That was no longer the case, and by, I would say, week 5, you could tell it had an impact on the staff. So us as managers, we thought, right, we can see the staff dipping here. We've done 5-6 weeks. How are we going to keep their morale up? So again, it was managing the risk to the staff, making sure they were safe, but it was also keeping sure their well-being was okay, because you could see them dipping at the start, and they still had fears of coming in and asking all those questions. So it was reassuring the staff. So what we did then, we done a few Zoom meetings of quiz nights. So we did, to keep staff morale and to linking in with other staff. As much as we were coming in on a daily basis, there were staff we hadn't spoke to for 5 and 6 weeks that we hadn't seen. So we did Zooms at night time in our own time, just to keep staff morale up and just to keep that communication going. So again, it was just making sure that everybody was happy enough. And again, guidelines were always changing. So every time something changed, we had to then update the parents, update policies, update risk assessments. It was constantly just update, and keeping what it was in line with the guidelines, and keeping it in with social services. And again, in that, we had to then, in the middle, register another building to allow the staff members' children to come in as well, to cater for the staff, to bring their children to work with them. But again, a lot of guilt with the staff came, and still a year on, again, we're in another lockdown. We're back to homeschooling. We're back to key workers' children. Again, a lot of guilt with the staff, because as much as the schools have provided the opportunity there for key worker children to come in, it is made very clear through a lot of the schools that only if there is no other alternative. So again, you're going back to putting pressure on women to go, am I putting my child in here and there's not, I have another, is it a greater need, or am I putting pressure on the schools? So again, we had a lot of parents or staff coming in on the second lockdown, still with all the same worries, concerns. And again, some of the other staff didn't intend, because at the start it was 2 key worker families. So at the start, that didn't take into account. So we had single parent families that was then contacting the school to go, yes, I'm a single parent, I'm a key worker, can my child come in? And again, it was put to them only if you have no alternatives, only if it's your last resort, only if that is your greatest need. So again, it's a lot of guilt put back on women and their families to source childcare. And then it is the children themselves, because it's made quite clear from a lot of the schools that when they go into the school, that they'll not be taught, they'll not be doing their schooling. They are basically only there to care for your child, basically. So again, it's the children as well. So a lot of the older children put pressure on the women again that they didn't want to go to school, to getting them to school. So again, we're having to start work at 9 o'clock. It's a different for the children. You're having to take their well-being into account to get them to school. So again, still a lot of worries and challenges with staffing, but again, always looking at ways now. So we started off for 15 families. We have now brought our services up to 60 children. And again, which was quite hard for us, we had to turn away a lot of children that came to us on a daily basis. And we had parents coming to us going, is there any way you can look after my child? Because if I don't, I'm going to lose my job. So we had parents coming to us, especially single parent families coming to us, that they had no alternative childcare. But due to the restrictions, we could only take so many children in. There wasn't everybody we could cater for. So there was families we had to turn away. And that was very heartbreaking, that families that used our centres for years to know that that parent was having to give up a job that they have had for years, and we couldn't facilitate because there was only so many children that we could come in. So again, we facilitated those families in other ways through food hampers, through support with gas and electric. And what our staff did, sorry, what our staff did working on their week from home, they linked in with all those families that could no longer attend our centre. So they linked in with those families to see, was there any additional support we could give them? Was there anything else we could help them due to food parcels, help with electric, gas, anything, or even toys and equipment for the children, because some children do come to our services, don't have the privilege of having lots of toys and equipment with that in the home. So again, some family members didn't have the resources to keep their children entertained. And again, we had numerous phone calls to the centre with families' well-being dipping because they didn't know how to keep their children's morale and their own morale up at home because we're very scared. And a lot of families didn't have gardens or outdoor play, so they were confined to the house quite a lot, which was quite a, and again, we had parents linking in with us. Sorry. So again, even though when we were providing a service on the week that the staff was in the centre, we were still also providing a service for the parents at home that we could no longer reach. So it was just, and then we also had to make sure that our staff as well that was carrying out these services, was their mental health okay? Were they managing? Because they had also impact. So it was just managing the staff team, keeping the morale up, keeping all those risk assessments going, following all those guidelines and adapting with the change. And a year on, we're still here. So we are, and we're still changing. So, and we will always will. So that's more or less from me. Thank you very much.
Thank you so much, Julie. That was incredible. And it's just amazing to hear about how resilient you were and the level of extra work that was needed within your childcare setting, not only to make sure that you were compliant with all the regulations, but also taking on that emotional burden and trying to support families with the guilt that they went through. It's incredible. So thank you so much for that. I really appreciate you taking the time to tell us about your experiences.
Thank you.
So next up, our final speaker, we're going to go to Susie Douglas, and Susie is a registered childminder and member of Unite, and she's going to tell us about her experiences as a childminder through COVID, and particularly how it's been so challenging for childminders and some of the issues where childcare in general was barely looked at. When it got to childminders, it was even worse. So we're going to go over to you, Susie, for about 10 minutes, and then I have 3 or 4 questions that's been submitted.
Thank you. First of all, thank you guys for having me here this morning. It's been an incredibly tough year for everyone, and kudos to every single one of us for not being entirely grey and still relatively sane. I became a childminder long before I had my own child. For me and many others, it's not just a job, it's a vocation. We do this job because we love it. Supporting and guiding children through their early years, watching them learn, grow, develop new skills, master emotions, gain confidence. It's not a job where you're ever going to get rich, but it's a job that brings immense satisfaction. When COVID hit last March, never in my wildest dreams did I think we would still be here a year on. For me as a registered childminder, it's been a roller coaster of highs and lows. The lows being the same as the majority of other childminders: reduced income, losing children, worry, stress, additional paperwork, financial strain, wondering, will I manage as a business to survive? Will I actually get through this? But my biggest high was March last year. With the guidance around childcare changing so fast, it quickly became apparent that registered childminders needed a voice, a grassroots voice that was coming from the people on the ground doing the actual work, who knew what the issues were. Out of that need, the Registered Childminders branch of Unite was born. A small number of us set up the branch. This is something that had never been done before for self-employed people. I'm delighted to be a part of it. The number quickly grew to 100, then 200, then 300. Now we're almost at 400. We realised that the decision to open childcare to health and social care key workers was a huge mistake, as essential workers such as supermarket staff, delivery drivers, engineers, all still had to go to work, but they didn't qualify for childcare. I had to turn away families that I had provided care for years. I had to pick and choose, and that was really, really difficult. We'd also been told that we could only care for 2 families at a time, but this is where we saw inconsistency starting to happen within the trusts that regulate us. Some were saying you could have 2 per day, so that could have meant 10 families per week if you had 2 different families a day, and other trusts were saying 2 in total. So there was a lot of misinformation coming through. And then it became clear that the childcare situation had not been considered in the pathway out of lockdown or the economic recovery plan at all. Caps on our numbers were still in place, essential workers being denied places. This is when we realised how important being part of the union was. We needed clarification, and we needed it fast. We needed to be able to approach the relevant people ourselves and to be recognised as a representative body dedicated to registered childminders. With this in mind, we set up Zoom meetings with the heads of all parties in Northern Ireland, including the First and Deputy First Ministers. The Union Committee explained why the current restrictions were not feasible and why changes need to be made. Some changes were introduced. The list was extended to include essential workers. The cap on 2 families was increased to 3. For many childminders, this was a huge relief. They no longer had to choose who they could offer childcare to, but it still wasn't enough. Registered childminders had 3 or more families needing care. So we went back again and we fought again. And finally in August, the restrictions were lifted and it saw our sector almost back to normal. The next stage was funding. We had been excluded from rates relief. We had been excluded from the small business grants. We had been restricted for so many months, and the added costs of PPE, cleaning materials, reduced income. We realised how vital it was to secure funding, so we teamed up with NICMA. We put forward a proposal to the Department of Health. Funding was agreed for recovery support to ensure our sector could remain open. Then isolation funding for any childminder who had to isolate due to a positive case, either in their setting or because they themselves had to isolate. This was greatly appreciated. But this third lockdown, this has definitely been harder for our sector, with many parents working from home or on reduced hours or even being made redundant. In the last week, I personally have lost 50% of my income, and I'm aware of many more childminders in the same boat at this stage. This brings into question the sustainability of our sector. If we cannot secure funding in the here and the now to get us through the next few months, there are going to be many registered childminders who are going to be forced to close their doors for good. And this will be a huge blow to the childcare section. We are aware affordability and accessibility are at the core of many childcare campaigns. And whilst we agree that these are extremely important, these 2 issues simply cannot happen at the minute with all the discrepancies between the childcare spaces on offer here in Northern Ireland and what the rest of the UK can offer. The implementations in Northern Ireland mean that we are offering roughly 40 to 50% less childcare spaces than our counterparts in the rest of the UK. These are issues that need addressed urgently. As in order to maintain our business in the long term, registered childminders may be forced to increase their fees in line with increased costs, mounting debt that's been accrued through the pandemic, borrowing from families, friends, savings, credit cards. This is a situation that none of us want to see, and one that may remove many affordable childcare spaces from the sector. This will have a huge impact on the choices that are available to parents. And as we know, the majority of childcare falls to women. So once again, it'll be dominant female be affected. Prevention is better than cure. It's imperative that going forward, any childcare strategy that is implemented involves the Registered Childminders branch of Unite as women, parents and childcare providers. Thank you for listening to me.
Thank you so much, Susie, for sharing your experiences and how challenging it's been for the past year. And it's amazing to hear how you were able to come together, form your union branch, lobby on the issues, just true resilience, and resilience that you shouldn't have to do. You should be included in these decisions from the outset. So being excluded from funding and even getting access to PPE, it just shows the challenges that this sector faces. And I totally agree with you. Any provision for childcare that's brought in can't be done at the expense of those working in the childcare sector. There needs to be radical investment into the sector to ensure that there is sustainability, and definitely need to work together on all of this to make sure that happens. So thank you so much. It has been amazing to hear from all of you on your experiences of working in the sector, particularly the challenges that haven't been considered by the executive and trying to work away in this field of uncertainty. It's extremely challenging. We have a few questions that's come in, so I'm going to just run through them in order here, and then I'll open it up to whoever wants to respond to them. So the first one that we got in is from Susie, or no, sorry, it's from Sharon, who is a registered childminder, and her question is around, well, actually, Sharon, I want to check, do you want to ask your question yourself, or do you want me to? No bother. So Sharon has asked around COVID recovery support funding, really, where is it? And in chatting to other registered childminders like herself, it's extremely difficult because people are financially hanging on by their fingernails and listening to gut-wrenching sobs over the phone while they're openly explaining their very real situations and the challenges facing childminders. It's heartbreaking. Since January, and like you mentioned as well, Susie, a lot of childminders are on reduced hours now and are on their knees trying to get specific dates. So if there's any update at all on when this funding will be available, I think I'll probably go to Aoife to see if you have any update on that.
Yeah, thanks, Rachel. And it's a great question, and it's very clear from listening to Susie, to Julie, just how vital this is. So, and thank you for sharing that. In relation to the Sustainability Fund for January to March, there isn't yet a date for that or further detail, and I know that that's immensely frustrating. What the Education Minister, Peter Weir, has confirmed publicly is that he hopes to announce further funding to assist with sustainability in the near future. And I know I'm part of the Childcare Reference Group. I would say there is definitely a recognition of how urgent this is, and we have been pushing for details to be announced as soon as possible. And as soon as that happens, we'll make sure that we're pushing it out on our website via social media and trying to raise awareness of that. Just to put it in a bit of context and to make sure everybody knows, the temporary closure fund is open for January to March 2021, so that has been extended. So if you or anybody you know or anybody you're working with has been affected by a case of COVID-19 or a requirement to close your setting or in a group setting to close a pod, please do apply for that fund. We have an article on our website with further information, and it's being administered through early years. I would very much, it's very familiar, the stories that you've been saying about how frustrating it has been across the past year, trying to get access to information, access to funding, making sure childcare is at the forefront. And it has been through working together, I think, that we've achieved a lot of the progress that has been made. So to the end of December, £20.5 million of emergency funding has been provided to the childcare sector to assist in sustainability and provide those contributions during a period of temporary closure. We know more is needed, and I would hope that in the next days, weeks, sooner if possible, we'll get details of the sustainability fund. And just, sorry, finally, I don't want to take up too much time to say, there has been some real progress from those early days when childcare simply wasn't given a look in. We have now got an all-party group, and if anybody wants to be involved in that, please contact us. It's secured a commitment to a strategic insight lab, which is going to be happening in the coming months on the childcare strategy, and a review of the minimum standards, which is going to be going ahead with the Department of Health. And I think that's definitely come out as something that's really critical in the absence now of a childcare strategy. Looking at those minimum standards might provide some real assistance for childcare providers who we know are struggling at the moment.
Thank you so much for that, Aoife. Our next question then is from Caroline Rice, and Caroline is another registered childminder. So let me just check, Caroline, are you happy enough for me to ask the question, or do you want to come in and ask it?
No, you can ask away.
Thanks, Caroline. Okay, so Caroline has asked, so how do we ensure that any childcare strategy moving forward is inclusive and has adequate responses? The previous plan had less than 200 responses. And how do we involve the providers, particularly registered childminders, who have had little to no actual voice within the strategy and reference groups that steer the policy that impacts on us? So that's an absolutely brilliant question, Caroline. And I share your frustration around being involved in the strategy. At the minute, there hasn't really been any progress or any involvement on it at all, despite our constant calls for it. And I totally agree that registered childminders need to be very much at the heart of that, any planning that does happen. We're struggling to get involved as well in the women's sector because of it being a gendered issue. But I'm going to open it up to see if anyone else wants to respond in particular on progress with the strategy, the last response, and how to make it inclusive.
I mean, I'm happy to come in briefly on that, just because I think it's really important. It's a great question, and it's important that when we get a strategy, everyone here and everybody who's involved in the childcare sector can see themselves in it, can know that they've helped to shape it, and that it meets their needs and is informed by their lived experience. So that's what we're very much hoping to use the all-party group for. It was great that at the last session Susie spoke. We heard directly from childcare providers, and I think that's going to be critical in this strategic insight lab that's due to happen over a period of time. It's got to involve everyone who has a voice and has that experience. I mean, we were certainly frustrated at how long it has taken since the consultation on the last childcare strategy. It took the Childcare for All campaign being established to even get the responses and an analysis of that published. So I think it shows the importance of us as groups and as individuals coming together and making sure that we can get that voice heard. So the Childcare for All campaign also being a mechanism for that. And it can be difficult with anything, even something like this together. I know we're all, as Employers for Childcare, for example, when we do our research, we rely on a time commitment from childcare providers and parents to feed in, to give their time. And we feel like we're often asking people to share that. So anything that we can do, we're always keen to hear also from the sector, anything that we can do to promote your voice and to bring you into these conversations, we're always keen to do so.
Yeah, and just on the Strategic Insight Lab, Aoife, I suppose that, as mentioned in the last all-party group, it'll be the Department of Finance, they'll be running and facilitating this. They'll be the ones working with the Department of Education to identify people, and they'll be the ones who will be opening out the consultation and how they develop the Strategic Insight Lab and how that works. So they did mention that it will be in different stages. So first it'll be going through the MLAs, the committees, they'll be getting the political voices as well. So there'll be different stages, and that's how they'll end up, suppose, doing the Insight Lab. So we'll definitely keep everyone informed, and if we hear anything, we'll be sharing it. And I suppose it really will be up to the department who's organising it to reach out to people.
Thank you both. And Caroline, I share your frustrations on this as well. And I think what we need to do together is make sure that we're holding the departments to account. And they keep talking about co-design and co-production recently, and that was a part of New Decade, New Approach. Well, we need to come and say to them, we are the groups that know what needs to be in this strategy. Here's a group of registered childminders. These are their concerns. It needs to be a part of this. So all I can say from the women's sector side of it is that we're campaigning on it to ensure that it's recognised as a gendered issue, and we will happily continue working with yourselves through the Unite branch, but also through the Childcare for All campaign. We have one more question because I know we're finishing at 11. So our final question then is from Helen Crickard at Reclaim the Agenda. And her question is about funding for childcare providers, particularly the women's centres. Have they had any indication that they will be funded beyond March? And I know this is a huge issue because loads of workers in the women's centres don't even know if they'll have a job after March as funding ends. So I don't know whether to open this up to Aoife and see if Julie, you want to come in first and see if Aoife has any comments then.
Yeah, I'll just start off. Yeah, no, we haven't had no word back. Again, through all these stressful times, staff had to be then brought in and told that at the minute there's no wage, no funding, and this has been going on for 10 years. It's the whole repetitive cycle that every year we have to wait until March to see is there our wage available, and when they do, it's never for time as well. You're never told your wage in time. So generally what happens is the centre has to go into sort of holding our wages themselves through the centre, have to try and find money to keep our wages going for the extra month, and in hope that we will get our funding. And again, even through the whole pandemic, when we were doing 1 week work from home and staff were panicking and ourselves going, how are we going to justify this to funders? You know, you're constantly going on about funding, but no, there has been nothing on wages yet. Staff are all still waiting. So as much as they're being stressed working through all this pandemic, nothing on wages yet has came. And it's now the 4th of March, and our wages, we only have wages to the 31st of March, and still no word. So all staff are on protective notice as if nothing comes from March, which is very stressful. So that's already adding on to the stresses that they already have, but no, nothing through the women's sector yet for wages, and very stressful and worrying for parents. And again, even that they're year about, staff can't plan. So if staff want to go for mortgage or other things, you're stuck back to that every year, that they're only releasing funding for 1 year. You know, it's every year is the same. And the fact that it happens every year it's held to the last minute for your wages to be signed off and approved. So again, you would think if this has been going on for 10 years, there's bound to be a better system, that you can't release wages for 3 years or 5 years, that it has to be done on a yearly basis, which is very frustrating for us.
Definitely, Julie. And there's just insecurity across the whole sector. It's the same in the women's sector. There's loads of women I work with and women's organisations don't know if they have a job at the end of the month. But you know, we're still expected to continue working. It's such an extra amount of stress on people's shoulders on top of all this. So thank you so much. Aoife, have you heard anything more about funding at all?
Not on the Women's Centre Fund, and I think Julie was absolutely right and expressed it very well there. It is a disgrace really, and it's part of more broadly of a cycle of budget planning in Northern Ireland where we're still seeing year-to-year budgets, and we were meant to have multi-year budgets. I think that's critical. We can't go on like this, and obviously you can't. So I think it's got to be resolved, and it's got to be part of the childcare strategy and the commitments coming out of New Decade, New Approach. One thing I would say, and not on the Women's Sector Fund specifically, but it was brilliant to work with Siobhan and Karen at the end of last year. So there hadn't been specific mention of the women's centres in some of the sustainability and temporary closure funds. So Siobhan and Karen did some work talking to women's centres, and now that is explicitly mentioned. There's still some case-by-case consideration where there is other funding, but now the women's centres are specifically mentioned. Apply for those funds. So it was good to get that addressed as part of the Department for Education funding coming through, which I know is separate to the DFC funding, but it's something that we continue to press on as well.
Thank you, Aoife. And I think really the common theme across all of this is whether you're registered as a childminder and considered self-employed, or whether you're working in a women's centre or a different childcare setting, or even in the women's sector, is that there's just no sustainability as it is at the minute, despite how crucial all of this work is. So I think looking at childcare and COVID 1 year on, if anything, it's got worse. And I think the experiences from everyone that spoke today really just shines a light on that and how we need to work together to continue lobbying on this. Childcare workers cannot be treated like this anymore, and women can't be excluded from work anymore because they can't access childcare. So what I will say, I'll try and end on a positive note. You are all phenomenal women, and really just shows the importance of our theme for International Women's Day this year in celebrating phenomenal women and calling for a new phenomenal. So thank you so much to all of our speakers and participants today. I've really appreciated all the questions coming in and all of the speeches as well. So we'll call it a day there. I'll have this uploaded on our website shortly. We'll send it out to everyone. I'll send you the International Women's Day programme as well, and also a short survey, which I would really appreciate if you could fill out, because it will help us design future events and continue lobbying on childcare. So thank you, everyone.
Thank you.
Thanks so much.
Thank you.
Thank you.
Bye.
Bye.
Bye.